Hello everyone, I am Dr. Rajakumar, consultant pulmonologist. Today we will be discussing about the normal myths which are associated with the tuberculosis infection, which is TB, generally known as TB infection. People think TB, it is a contagious disease. Yes, it is a contagious disease, and it is infectious from one person to the other person. So I just want to give a brief idea when this tuberculosis infection is more contagious. So TB is contagious when it is affecting the lungs, which we call it as a pulmonary tuberculosis. When the tuberculosis bacilli is growing in your lungs, so that is the time when you will develop symptoms like cough and weight loss, fever. So when the person with the tuberculosis infection is coughing, generally we will generate that if any other person is inhaling those aerosols or air particles which have been generated from a person who is infected with the tuberculosis. So it is a similar mode of transmission as all of us are aware of the similar like COVID infection. So if anybody is infected with the tuberculosis, if he is speeding on the road and then someone just come into the contact from that, so that person can be infected. So that is the main mode of transmission from one person to the other person. So what are the most common myths associated with the tuberculosis? Is tuberculosis always infectious? No, as I have told earlier, only pulmonary tuberculosis is infectious. So, which TB is not infectious? Any other TB other than pulmonary tuberculosis. So, as we all, most of us know, TB can infect from any of the organs, from head to toe. It can infect the brain, it can infect the kidneys, liver, intestine, bone, muscle, all the parts of the body can be infected. So, when the TB is infecting only the lungs, then only it is infectious. So most commonly people would have come across, people are saying we had a glandular TB. So usually those people who will what we call as tubercular lymphadenitis, which they will get the swelling in the neck, swelling in the neck of this side or neck or in the axillary area. So those are the most commonly encountered tuberculosis, and that tuberculosis is not infectious. And the second myth commonly is if a mother is infected with the tuberculosis, whether during the pregnancy or immediately after the delivery, which is postpartum. So is the child at high risk of contracting the tuberculosis? Yes. Baby delivered to a mother who is infected again with the pulmonary tuberculosis or during the postpartum who is on the breastfeeding baby, yes, that baby is in high risk of getting infection through the mother. So is it advisable to give breastfeeding to the newborn baby? Yes, because it is a must. So what we can do to prevent the transmission from a mother who is infected with the pulmonary tuberculosis to a newborn child. So the basic thing, as we have discussed earlier, the infection is spreading through the aerosols, through the droplets. So one thing, the mother has to make sure that she is wearing a double mask so that she is preventing the coughing or the droplets or the aerosol from her to spread into the baby. And it is advisable the mother has to carry on with the breastfeeding. Second myth, is it contagious if we are eating on the same plate? Yes, because as I have discussed earlier, when we are sharing the same plate, patient has to be eating in the same plate, so there is a high chances of saliva mixing, and that can be spread from one person to the other person. Is it contagious by sharing the same clothes? Yes, because when we are coughing, whenever we are coughing, we are closing our mouth with, then the cough droplets will be on the sleeves. If it is not thoroughly washed, thoroughly not disinfected, yes, that person is in high risk of contagious and getting the TB infection. And is it contagious if we are sharing the same bed? Yes. So any proximity, if the patient is diagnosed with the pulmonary tuberculosis and if he is living in a home where the people are around 4 to 5 people, if he is living in a close proximity and he is coughing rigorously, where he is generating more aerosols which will contain the tuberculous bacteria, so that particular family is in high risk of developing tuberculosis infection. And what about the condition, like what is the things to take to prevent the tuberculosis infection? So as we discussed, it is only the infection is through the droplets and through the improper disposal of the sputum. So first thing is to prevent the coughing, we have to wear the mask. Second thing is we are not supposed to spit on the public places and any open places. As we spit, that we have so many of mosquitoes and flies which will take away those droplets and can be transmitted from those infected sputum through the food particles and through into the stomach. So as we have discussed, TB can be infecting all the intestine, any other organs. So these are the another mode of transmission. Third one, is the TB is same infectious from day 1 till day last of the treatment? No. So as we've discussed, TB is infectious in the initial 2 months. As we start the treatment at the right time with the right medications at the correct adjusted doses, the TB infection can be reduced to 99% within a month of the exact proper treatment with the tuberculosis infection. So this one thing everybody has to keep in mind is, if the patient is being treated with the anti-tuberculosis drugs for more than 4 months, his infectivity will be reduced to almost 0.1% to negligible amount. So the patients who have been newly diagnosed with the pulmonary tuberculosis, not has been started on the proper anti-tuberculosis treatment, are at 100% risk of transmitting the disease from him to the other people. Whereas the individual with the proper diagnosis and correct treatment, after the treatment within the 4 months, the infectious rate is going to reduce to 99%. So any newly diagnosed patient, yes, he is highly infectious and he is prone to infect the other persons very fast. Whereas the individual who has been treated with the anti-tuberculosis drugs, his infectious rate will be reduced drastically. So here one thing we have to remember is, with the correct treatment on the right time, we can prevent the disease and prevent the spread as well. Tuberculosis can be completely cured and we can be totally prevent the disease also. So population who is at the high risk of getting infection from an infected person. So all the infections, predominantly all the respiratory infections, are in the same category. Those individuals with the weak immunity, those are like with the diabetes and chemotherapy, or elderly people with more than 55 years of age, chronic habits of smoking and alcoholism, those with the CKD, chronic kidney diseases. These are the particular population who are at the high risk of developing tuberculosis. Next comes the younger generation, who are the newborn babies, as we discussed, baby born to a mother with a known pulmonary tuberculosis infection, and within the early age of 6 months. 6 months, the high chances of getting infected. Next myth is tuberculosis. Once we get tuberculosis, is it like we will get it again and again and again? No. With the correct treatment, as the doctor advised, if the doctor has advised to take the treatment for 6 months or 8 months or 1 year, based on your condition and based on the type of TB which you have developed, with the correct doses, with the correct duration of the tuberculosis can be completely cured. So there won't be any reinfection unless if you are exposed again and your immunity is weak. So there has to be a new infection. If the treatment is followed as per the doctor's advice, so the tuberculosis can be completely cured and the person can be absolutely non-infectious to any other persons. So these are the most common myths. So with the right diagnosis and with the proper medications, TB can be completely cured and can be prevented spread from the one person to the other person. Thank you. See you in the next video.